Hello. Uh, First of all, I would like to thank the CBS Conference Organizing Committee for giving me this opportunity. My study is titled The Coordination of Care in the Management of Breast Cancer. It's a qualitative insight into patients and healthcare professionals' perspectives. I would like to thank the members of our research team, Professor Majda Sebbani, Professor Latifa and Professor Mohamed Amine. Here are the contents of my presentation. As you know, breast cancer is the leading cause of cancer death in women worldwide. In Morocco, it is the first cancer in women and the third of all kind of cancer registered cases. The coordination between levels of care comes to promote better care for patients. So the objective of our study was to describe the coordination of care in the management of breast cancer at the level of the prefecture of Marrakech from the perspective of patients and healthcare professionals. Now, for methods, the study design was a qualitative descriptive study. We used a semi-structured interviews. We used the Nvivo software for data analysis. For the ethical aspect, we got an approval for the ethics committee from the School of Medicine of Marrakech, and our study respects confidentiality, data anonymity, a right to withdraw at any time for participants, and free and informed consent. For population and sample, we adopt purposive sampling regarding the study design. So we had 8 patients and 10 healthcare professionals. Now for results, especially for the socio-demographic characteristic of the patients. Most of them were illiterate, were 13 years of age and older. 6 patients were married and unemployed, respectively. 4 of them had the medical assistant regime, which we called in Morocco RAMID, or affiliated with a mutual health insurance. In addition, 4 patients were from rural area. Now for the socio-demographic characteristic of the healthcare professionals. 7 of them were women, including 5 nurses. The others were general practitioners and specialists. 8 participants had 10 years or more of professional experience. Now for the dimensions of care coordination, the analysis revealed that the perspective of patients, both perspectives revealed 3. Each of the perspectives revealed 3 dimensions and 1 common dimension, which is communication. Now for the patient perspective, we have orientation, empathy, communication, and satisfaction. So for orientation, a patient said, "I didn't start treatment immediately given the number of staff, the very long appointment times, and COVID-19, so I stayed at home and no longer consulted." For the empathy, we have a verbatim of a patient which said, I'm not going to lie to you, but there is no empathy in caregivers. They ignored me so much, no guidance. I was in pain and they didn't even explain my conditions to me. For communication, a patient said, there is no communication. I remember well when I asked questions to anyone, nurses or doctors, they tell me that everything is written on my file. For satisfaction, patient said, I'm not satisfied at all with all the care I received during all levels of care. I wasted a lot of time. It's been almost 2 years now and my condition is still getting worse. Now for the healthcare professionals perspective, we have 4 dimensions: information, relationship, communication, and training. For the information, a physician said there is no transmission of information between healthcare professionals, healthcare levels. I think primary level doctors are generally scared of patients with cancer, so when they receive such cases, they always refer them to the oncology center. For the relationship, a nurse said the nurse-patient relationship must be relevant. It becomes during their cures. Like a family relationship, they become attached to us and vice versa. For communication, a nurse said we need to communicate with patients. Actually, the fact that we are women makes communication easier and smoother. For training, a physician said that I can assure you that we are always up to date with the news in the different regions of Morocco. Now for the discussion, we'll give some elements of discussion. For orientation, authors recommend to streamline the patient's care pathway, facilitate the knowledge of the healthcare services, help them to make decisions, to improve their care and their support, and to optimize the organization of functions and activities by healthcare teams. For the empathy, Taligani 2018 states that the empathy of caregivers towards patients is negatively influenced by several factors, including the psychological distress of caregivers, the focus of the task rather than the patient, and the imbalance between the patient caregiver sexes. For communication, patients with cancer often associate the quality of care with their relationship with nurses, which is perceived to be important for the feeling of confidence and well-being. And for satisfaction, Bardanega et al. 2019 mentioned that the patient satisfaction is negatively influenced by poor relationship, the quality of information provided, and long wait times. Now for the perspective of healthcare professionals. For information, the care coordination depends on an efficient transfer of information between caregivers and at the healthcare levels. However, the healthcare professionals in primary care tends to describe these information transmissions when they exist as slow and insufficient. Relationship, the quality of the relationship between caregiver and patients is characterized by a certain misunderstanding. This is the an idea of Friedrich 2009. Communication. The healthcare professionals face several challenges that hamper effective communication with patients, namely that their high number, each reacting in its own way, variations in time, space, feelings, and the social and religious level, which differs from one patient to another. For training, Gossett et al. 2021 mentioned that the impact on training following the pandemic seems obvious. It has delayed the achievement of the objectives. Thus, in all countries, distance education means have been used. Now, for conclusion, we can give some recommendation to improve care coordination for the management of breast cancer, especially by reinforcing the values of respect, trust, empathy in order to strengthen the caregiver-patient relationship, by developing communication techniques among healthcare professionals, by developing a breast cancer management program according to the age group of the patients, by guaranteeing continuous training for the benefit of healthcare professionals. Here are the references that we use to make this presentation, and thank you for your attention.